When I first got to BVMI, that I was approved, I literally, when I finished, I broke down and cried. I couldn't believe this existed. Being told that this only existed by the graciousness of all the doctors and nurses that they fund this. It's not federally funded or state funded for that matter. I just couldn't believe it was happening to me and that this place actually existed right underneath me and I didn't even know.
Well, I'd like to first thank the board of BVMI for honoring me with this award. I would particularly like to thank Dr. Howard Lipton for initially involving me with BVMI. I can't think of any better cause to donate my time to, the health of Bergen County's patients. There's been nothing more rewarding for me to help these patients.
I'm humbled. I'm very gratified by it. I don't know how deserving I am. I think I'm doing a small part. And I hope my doing a small part encourages other physicians and other volunteers at every level of medical provider to do their part and do some volunteer work.
It's a very humbling experience because, you know, you're doing what you're trained to do, you're doing what you know it's the right thing to do, and somehow it doesn't feel as if you should be honored for that, you know. I don't know, I sometimes am a little embarrassed when people want to honor me for doing what I'm supposed to be doing.
It's very nice to be recognized. I guess it's nice to be thanked. It's not why I'm doing it. I won't say no, and it is very nice to be recognized, but it won't change the enthusiasm that I have for what I do or how I treat my patients at all.
I'm very honored and flattered. I'm not quite sure how I ever came close to earning the award, but I see it most as an opportunity to celebrate with you the important work that's being done and to bring further attention to all the work that needs to be done with those who need care and aren't able to achieve it easily in the current medical system here in Bergen County. We're in one of the wealthiest counties in the world, and yet we have some people here who are still struggling to achieve the health care that they so desperately need. So thank you for filling in that gap, for being here for them and for me.
When we take that oath, when we graduate from medical school, you know, we don't pay attention when we're taking care of patients as to, okay, who's paying what. I say doctors are some of the worst business people. We just take care of patients. We don't even worry about who's going to pay what. So time is money doesn't really apply to us.
Well, the exciting thing is that time is not money because I don't get money for taking care of Mr. Bustos. And that's part of the good part about it, actually, because when I'm taking care of patients who are in a situation where they can't afford, then I feel even freer than usual from the make it up in volume approach that's so much influencing medicine today. You always got one hand on the watch and the other hand on the printer and the computer, and you don't have time to sit and spend not a whole lot of time, but a quality time with the patient without regard to time and money.
If time is money, I'd like to buy some time for sleep. Other than that, I don't particularly perceive it as that, and does it really take that much time out of my day to see people who can't afford to get the care they need? It may, but so I'll sleep a little bit less, I'll eat a little bit faster, I'll work a little bit harder, but it hasn't seemed to have had much of a negative impact on me this last decade and a half.
I can't think of any better cause to donate my time to than to the health of patients of Bergen County.
I get back a good feeling inside, a feeling like it's not 9 to 5 or 7 to 7 every day. I feel like I'm doing something over and above just a job. I think I get at least as much, if not more, satisfaction to seeing the BVMI patients in my office.
Dr. Watson, le agradezco mucho de corazón, que Dios me lo bendiga, que siga así ayudando a las personas y que estoy muy agradecido con usted y que me siga tratando.
Sí, sí, sí.
Okay?
Sí, sí, claro que sí.
Please dig deep. It's worth it. These patients are worthy of the care that can be provided every day from BVMI. They're in a segment of the population that has typically been overlooked, and they need our help. Please dig deep and be generous today.